Hello, I'm David Hutton, Executive Editor of Ophthalmology Times. The American Society of Retina Specialists annual meeting has gone virtual for 2020. We will continue to provide the quality content from events that you've come to expect. Today I'm joined by Dr. Justis Ehlers. Thank you for joining us. Tell us about your presentation.
Yeah, David, thank you so much for having me here. So I had the opportunity to present on risuteganib and potentially some OCT biomarkers that may be important for its use in dry macular degeneration. The phase 2 study that was initially done with risuteganib looked at this in intermediate AMD as a potential treatment that might improve visual acuity in those patients. And it met its primary endpoint compared to sham, and that was that 48% of patients who received risuteganib actually improved 8 letters or more by the primary endpoint. And so one of the questions as we looked at this data, it was a relatively small study, but we wanted to know, are there factors that may predict who would respond to the treatment? And so we had about 50% of patients who did respond compared to those who didn't. And what we did for this study was 2 independent reading centers, one here at the Cleveland Clinic and the other one led by Glenn Jaffe at the Duke Reading Center, look specifically at the analysis patterns of various retinal areas and retinal zones, particularly with interest in the outer retina, to look for if there were any particular markers that at baseline could predict who would actually respond to risuteganib and who didn't. What we found actually at both reading centers independently was that outer retinal integrity seemed to be really important in terms of those eyes that were able to respond. And so there was a significant difference between that 48% who gained 8 letters or more compared to those eyes that didn't, in terms of everything from ellipsoid zone integrity to central subfield, EZ to RPE thickness, which we think is sort of a surrogate for photoreceptor outer segment thickness, as well as the outer nuclear and outer retinal thickness as well. And this was very consistent between the 2 reading centers. These are doing some complex measurements that aren't typically done for most studies. But now as we're getting better and better software and better imaging systems, we're now able to do some unique measurements that we haven't been able to do in the past. We're using machine learning augmentation to help the accuracy and consistency of those measurements. But it's exciting because we think that this may actually be able to help us identify patients who may benefit most from this therapy, and may also be able to use as a screening tool for gating the next larger trial, which will hopefully help us better understand how risuteganib may work and whether or not it's a viable option for us with dry AMD in the future.
And what's the take-home message?
So I think the bottom line is that as we're getting more and more able to actually analyze images, and there's a huge amount of information in the imaging that we do in retinal diseases, that there may be some critical pieces that we're able to now measure that may help us predict drug response or predict overall outcomes in patients. And in this case, what we found was that in eyes that had better outer retinal integrity and ellipsoid zone integrity, those were eyes that were most likely to respond to risuteganib in this study.